Welcome to AHA's Go-To Practice Solutions video series, where we ask our industry partners for their solutions to some of the most challenging issues facing veterinary medicine right now. Today, we'll be talking about improving the diagnostic capabilities of point-of-care laboratory testing without overextending our teams. The AHA Senior Care Guidelines recommend yearly wellness testing for dogs and cats beginning at middle age and repeating a minimum database, including complete blood count, every 6 months for senior pets. We know frequent lab testing benefits our patients, but as both we and our clients get busier and busier, we need efficient diagnostics that deliver fast and reliable results. Industry leader Zoetis Diagnostics is addressing this challenge by offering the addition of qualitative information to quantitative point-of-care testing. Let's hear more from Zoetis about a way to run routine blood work that's anything but routine.
Welcome to this talk. My name is Dr. Paul Ramsey. I'm the owner of the Animal Medical Center Euclid, and we're going to talk about routine senior checkups that become anything but routine. And this is going to be a case study in hematology. So, typical morning here at AMCFE. As like any other clinic, we're dealing with a lot of clients and a lot of patients that we're trying to fit into our busy schedules, and today would be no different. We had a typical drop-offs that we see in the morning that we typically stabilize and try to treat and work up during the time of morning appointments. Luckily, this time around, the morning appointments have been pretty straightforward and standard, and we were able to catch up time. Our last appointment in the morning standing between us and lunch is a routine senior exam by a longtime feline patient named Lilith, and hopefully this will go very smooth as we expect the chill. So good old Lilith. She's a 16-year-old female domestic medium hair kitty cat that's about 13 pounds and has come in here for just her routine checkups. As we send out for every 6 months for our senior patients, they get a reminder every 6 months to come in for the routine exams, CBC, chemistries, T4s, anal gland expressions in her case, and a fecal check as well. She's been a pretty stable patient. She had some elevated BU and creatinine issues back in 2018, but has been doing great at home. Our expectations for this: technician comes and talks to the client, obtains a history, gives an estimate, and obtains consent from the client. They obtain the blood work and the fecal, and then we start running those on an analyzer. And then I'll do my physical exam on Lilith. During that time, I'll also discuss my physical exam findings with the owner, as well as go over the normal results with them too. Hopefully with the blood work is our goal. And then finally eat lunch. And then, as anyone knows in this industry, that is extremely rare to do anymore. So what's reality? Technician obtains a blood sample via a jugular stick without an incident. Great, one dime. They also brought the fecal sample in a small container. So far, so good, and we can easily get it out of there. So then, therefore, the technicians go off and run all the blood samples and the fecals on their appropriate analyzers while I begin my physical exam finding. This picture always makes me chuckle a little bit because I believe this is exactly how my mom pictures me doing my physical exams on my patients. And in Lilith's case, though, we did find out that she did have some paler than normal mucous membranes, and her capillary refill time was less than 2 seconds. Her weight, though, stayed relatively about the same. It usually hovers between the mid 12 pounds to the low 13 pounds. And her hair coat seemed a little bit more coarse than usual. Her kidneys did palpate a little bit smaller, but this has been well documented and considered her quote-unquote new normal values. We did discuss all the exam findings with the owners while they were in the room, and I stepped out to check on the results, which they were ready to go as soon as I was done with the examination. So, got the chemistry results. I like looking at these via the Zoetis DX dashboard due to the fact that they allow us to quickly see the values, but more importantly, it can easily spot trends. And trending is extremely important when you look at any type of blood results that we get back. The nice part in her case, though, all her values were within reference interval. However, we did notice that the albumin is getting a little bit lower and the BUN has crept up a little bit, although the creatinine has come back down. So with that being said, 1 down, 3 more to go. The next results that were up were the thyroid results, and those came back within reference interval as well. So even better, we're doing great. On to the fecal sample. And this is what we ran in-house via the IMAGYST technology, and it will look for the big 6 fecal parasites. We look at Giardia, Coccidia, whipworms, hookworms, roundworms, and tapeworms. And the nice part is the technician sets this up while I'm in the physical exam, so this is ready to go by the time I step out of that room. And in her case, though, there was no parasites that were detected, which is great. She's also on monthly flea, tick, and heartworm prevention, so she's doing great in that regard as well then too. So last but not least, the great CBC. That should be straightforward. Crud. Her CBC now has a low hematocrit, which unfortunately means that she might be anemic. Again, I utilized the ZOS-DX dashboard, and I can quickly spot that this is, in fact, the first time that she actually has a low hematocrit. And that could be actually a significant finding then, too. And it correlates a little bit with my physical exam then, too. So now what? What do we do here? Anytime you have something that pops up as abnormal, you want to create a top differential diagnosis list and then work through that then, too. In her case, we came up with trauma, whole blood loss, parasitism, both external, gastrointestinal, intravascular, as well as autoimmune disorders, oxidative damage, neoplasia, and then also chronic disease can cause this as well, such as renal disease. So we have done diagnostics already, though, and that's the biggest thing I think we get overlooked. The physical examination is a great diagnostic tool, and I think it doesn't get as much value as it should in the veterinary world. In her physical exam, I did not see any open wounds. I didn't see any evidence of whole blood loss or trauma, and there's no evidence of external parasites either, like fleas and ticks. She's also on monthly flea and tick prevention, as well as she also has no other history of any type of trauma in that. So that quickly rules out differential diagnosis of trauma and whole blood loss. As well as her fecal sample came back no parasites seen, so it's unlikely she had gastrointestinal parasites. So we'll go back to the working differential list then here. With that information in hand, we can cross off trauma, whole blood loss. We can also cross off parasitism with external, as well as gastrointestinal parasites as well. Now we're still left with intravascular, autoimmune disorders, oxidative damage, neoplasia, or also the chronic disease. So how do we get to this point then to figure out what we need to do? A wise man once told me diagnostics begets diagnostics. And that's very, very true when it comes to this. You need to have diagnostics to whittle down your differential list to figure out which ones is actually the true tentative diagnosis that's causing the problem. Before we had the advances in technology such as the IMAGYST, it could take days to weeks to get this result. Now we can get this done in very quickly time, in minutes, in hours. And the best part is you don't have to chase after the client, get a hold of them, get the patient back, and delaying further treatment then in that regard. The IMAGYST, in my opinion, is the future is here. It's a really, really great analyzer. It utilizes AI technology to analyze blood smears, adding consistent qualitative information to your point-of-care diagnostics. That also allows you to do add-on reviews, which is similar to having a board-certified pathologist sitting in your clinic. And this will, you can get these results back in under 2 hours, which is phenomenal. IMAGYST AI blood smear technology creates a comprehensive CBC from a traditional quantitative CBC. And it's very, very easy to integrate in practice. For our protocol here at AMCFE, we have a technician that creates 2 blood smears out of the CBC while the CBC is being run on the HM5 analyzer. And then we start running them on the IMAGYST then at that point. The process usually takes about 2 minutes or less to start to completion then. Practice definitely makes perfect in these guys. The only way you're going to get good at CBC smears or blood smears in that regards is by doing them. And every CBC should have a blood smear created and ideally ran and interpreted via the AI technology on the IMAGYST. As I said before, it takes about 2 minutes to set this up and about 5 to 7 minutes to set up for the scanning for the interpretation on the IMAGYST itself. And this is exactly what we did in Lilith's case. During my physical exam, we got all the results done while I'm doing that. And then when I stepped out of the room, I had all the results back. I could talk with the owner about the next steps. This all take under 15 minutes, thankfully. So when we get the AI results back, there's an evidence of nucleated red blood cells and some polychromatophilia present as well. This could mean regenerative anemia, but it also could mean that there might be some parasites. So then, how do we tell the difference? The best way is to talk to a specialist. And the best part is we have a specialist sitting right in our clinic with the IMAGYST sitting there. With a few mouse clips away, you can send off all the information that you need to the board-certified pathologist, and they can get your result back then too. So then the pathologist sends you back a cytology report, just no different than like the cytology report you would get back as if you send out the glass slides. And it came back with no obvious neoplastic changes seen, no blood-borne parasites, no oxidative changes such as Heinz body formation, and confirmed that unfortunately, in fact, the anemia was non-regenerative. And then finally, it's super helpful is they give you contact information to talk to the pathologist that read the cytology, as well as they also give you helpful feedback tools about how your blood smear was. Because the only way you can get better is if you know you're not doing it right. And if you're doing something right, they'll let you know that you're doing it right so you can keep doing it then too, which is super helpful. So we go back to the working differential list. We already crossed off a few things, but now we can add crossing off intravascular disease, autoimmune disorders. We can cross off oxidative damage. We can also cross off neoplasia based upon hematological in origin. And then finally, we're left with a tentative diagnosis, which is actually chronic kidney disease. And I suspect that this anemia is probably due to decreased erythropoietin production from her damaged kidneys. So with a tentative diagnosis, the anemia is probably due to chronic kidney disease, and she's been battling this for 4 years. So this does happen, unfortunately, in our kidney dysfunctional cats. Just as a point of reference, the amount of time it took us to get all this information, all this differentials crossed off was a little over 2 hours, of which honestly took about 7 to 10 minutes of our direct action by myself and my staff. And then during this time, Lilith hung out with us in the clinic while her parents ran to the nearby restaurant to get a quick bite to eat. And then the best part is all this information is set up into the ZOS DX dashboard, so we have this information for future reference as well. And then on top of that, you can actually click on a consultation button through the ZOS DX dashboard to then get further information if you need to have any other further questions answered about either the treatment, the diagnosis, and then so on and so forth. And the best part is it's no charge to us as veterinarians. So with all this information, we come back and talk with her parents about this. We want to talk about the findings and tentative diagnosis with her of the fact that she has an non-regenerative anemia due to chronic kidney disease. And then fortunately, we find out that the mom and dad haven't been feeding her a special diet as much as she should be on. And this is common that we see that because she's been on it for so long, they feel like that she's been doing good with it. She may not need it as much. Unfortunately, in this case, she does look like it. We did cover about abilities to additional diagnostics and treatments at the referral hospitals nearby. And we also sent her home with some additional nutraceuticals to help support her kidney function. And finally, the most important thing is we set up recheck appointments for checking her blood work in the future to stay on top of this anemia and see if it's going to resolve itself as well. The outcome for her, she did great. Thankfully, Lilith responded to all her treatment plans put forth. Her hematocrit returned to with normal reference range, and her mucous membranes are no longer pale pink. She does seem to have a lot more energy at home, and mom and dad are quite pleased with how she recovered from everything. All this information, again, is loaded back into the ZOS DX website then too. So in closing, senior blood work, especially routine blood work, is essential. Even if it was normal in the past, it may not be normal in the future, and that's the very important. We don't know what the future holds unless we test for it. And utilizing the Vetscan IMAGYST AI blood smear technology, it adds a true qualitative information to our already quantitative information that we receive from the automated CBC analyzers. And that creates a complete, comprehensive CBC at the point of care level. And then you can utilize the add-on review, which allows for a more complete diagnosis, resulting in initiating treatment before the patient even leaves the clinic then. Finally, you can set up a consultation with the pathologist and or specialist to discuss this case, ultimately giving you a high level of certainty and comfort in your diagnosis, which saves you time by making you and your staff more efficient, all the while providing the best care for your patients. On behalf of myself and ZOS Diagnostics, I hope you found this information to be informative. Thank you for your time and your attention.